Bulabinaka, I'm Dr. Helena Rarukulu. I'm currently the acting TB control officer for the Western Division. First question that I need to address: what are the common reasons that our Fijian women avoid or discontinue using combined oral contraceptives, and what do I do? How do I address them? How do I address these concerns in our clinical practice? So there are quite a number of reasons and factors that contribute to our women avoid taking COCs. First one that I could think of is the fear of the side effects. One of the most common reasons that they avoid taking COCs is the fear of the side effects. Some of the common side effects that they usually complain about is the weight gain, a headache, mood changes, nausea, irregular bleeding, perceived infertility. Those are some of the common reasons of the side effects that they usually complain about, that also contributes to them discontinuing taking COCs. So how can I address them? First step is counseling. So we need to educate our women that these side effects only they are temporary. They only last about 2 to 3 months, and we need to also monitor and offer alternative methods if the side effects are intolerable. And we also need to reassure them and emphasize that fertility returns quickly after discontinuation of the COC. The other common reason that our Fijian women usually have in regards to COCs are their misconception of COCs. Most of them think that it causes permanent infertility. Some of them think that that it causes cancer. These are some of the myths that they have in regards to COCs. So how can we address this? Is having health education sessions with them in our communities, in our cities, in our clinic, in our outreaches. We do awareness and we educate our women in regards to their mythical to these reasons. We need to use also, when we educate them, we need to use simple language, simple terms, and also provide visual aids for them to see, to correct all this misinformation. Another reason that our women, one of the common reasons as well, is our cultural and religious beliefs. As we know, in Fiji, we are deeply rooted to our traditions and our culture. So these are some of the things. This is one of the factors as well that contributes to our women discontinuing taking COCs. Most of excuse me, most of our most of our communities in Fiji believe that taking COCs are morally or religiously wrong, that it promotes promiscuity. So these are some of the one of the reasons as well that they avoid taking COC is due to our cultural and religious beliefs. So we need to engage our faith leaders when we are addressing this issue. We need to educate our faith-based leaders in our communities, in our villages, and offer private confidential consultations. And we emphasize on the health benefits of birth spacing for mother and baby rather than promote birth control. So this is how we can address these concerns in our community. Also could be because of our partner and our family opposition in us taking COCs. Some of us in our community, our husbands or elders, may disapprove of Fijian women using COCs, especially in our more traditional setting. So the second question that I need to address is how do I approach counseling of Fijian women in rural settings or undeserved areas in regards to the risk and benefits of using CUCs, especially in rare complications like blood clots and or stroke. So for counseling, how do we approach our women in our Fijian communities? First and most importantly, in regards to counseling women, we need to be culturally sensitive when we are doing our counseling. We need to keep that in mind. We need to be clear as well. We need to use simple terms, simple language that they will understand. And also we need to have that empowering approach when we are conducting counseling to our Fijian women, to our patients. So first step in counseling is for us to build trust. Build trust and rapport with our patients, with our women. When we need to have we have to be respectful. We have to have a non-judgmental language when we are counseling our women. This is the first and foremost, this is the first step in conducting our counseling to our women. The second is second step is for us to start. Once we build that trust, we need to start. We need to highlight the benefits of using CUCs. So we can let them know that that using CUCs prevents unplanned pregnancy. It helps in menstrual regulation and reduces heavy bleeding or painful periods. It reduces the risk of having endometrial or ovarian cancers. These are some of the reasons some of the benefits that you can let them know in regards to CUCs. You can use simple language, simple terms. For example, simple sentences. For example, this pill helps you prevent pregnancy safely. It also helps your period become more regular and lighter. Those are some of the things that you can tell them when you are counseling our Fijian women in our rural settings. And the other thing that the third step that we need to take in counseling our Fijian women is we need to tell them the side effects as well. We need to gently explain the risk of taking CUCs. Explain as well the serious complications like blood clots and stroke, which are very rare but more likely in certain women that are smokers, that have high blood pressure, that have comorbidities, they have high blood pressure, and also some of the women that have migraines. We don't have to use complicated words when we are explaining the risk of CUCs. We can use simple language, simple terms. For example, you can tell them this pill is safe for most women, but in rare cases, emphasizing on the rare, it can cause problems like blood clots. And we need to check your blood pressure and ask questions to make sure that it is safe for you. Once we're doing this counseling, we need to use visual aids, example, risk charts or flip charts, if it's available for them to know. And the other thing that we need to address is from our part, we need to screen for risk factors before prescribing the CUCs to our women. We need to check their blood pressure. We need to ask about their personal and family history, if there's any comorbidities, any history of clotting, stroke, or if the patient is smoking, or if patient have migraines. And we also need to encourage them to ask questions. We should not be the only one talking when we are doing the counseling. We need to encourage them. We need to ask them what are some of their concerns. Most of them probably might ask you